In this chapter, questions will cover various aspects of protein structure and function, including enzyme kinetics, the transport of molecules across cell membranes, various mechanisms of catalysis, the binding of oxygen to hemoglobin, and various diseases that result from altered protein folding. There will be a mixture of clinical and non-clinical questions seen in this chapter. Question 1. A kinetic analysis of the effect of a drug on an enzyme's activity was performed, and the results shown below were obtained. The drug would be best classified as which one of the following? Question 2. A critical histidine side chain in an enzyme's active site displays a pKa value of 8.2. Which of the following best describes the local environment in which this histidine residue resides? Question 3. A major driving force for protein folding is the hydrophobic effect, in which hydrophobic amino acid side chains tend to cluster together, usually in the core of globular proteins. This occurs primarily due to which of the following? Question 4. A 7-year-old African-American male is admitted to the hospital with severe abdominal pain. A blood workup indicated anemia, and an abnormal blood smear, see below. The molecular event triggering this disease is which of the following? Question 5. A 56-year-old pathologist was taken to his family doctor by his son for mood changes, minor memory loss, and decreased motor skills. During the patient history, it was noted that he had occasionally cut himself with instruments used on cadavers during his career. A potential explanation for his symptoms is abnormal aggregation of which of the following proteins?
Question 6. A teenager, new to your practice, comes in for a routine physical exam. His family had just moved to the city, and the boy had rarely seen a doctor before. Upon examination, you notice a high, arched palate, disproportionately long arms and fingers, a sunken chest, and mild scoliosis. The patient has been complaining of lack of breath while doing routine chores, and upon listening to his heart, you detect an aortic regurgitation murmur. Careful examination of the eyes is indicated by the figure below. Based on your physical exam and history, you are suspicious of an inborn error of metabolism in which of the following proteins? Question 7. While working an overnight shift in the emergency department, you are called to see an 8-year-old boy who appears to have a fracture in his arm. Upon taking a history, you learn that this child has been to the ER multiple times for fractures, and the incidents that led to the fractures would be described as mild trauma at best. X-rays indicate a number of healed fractures that the boy and his parents were unaware of, see example of arm X-ray below. The physical exam shows sky blue sclera. The parents then inform you that the child is taking bisphosphonates for his condition. The mechanism whereby the frequency of fractures is being reduced in this patient is which of the following?
Question 8. You are visited by a 40-year-old female patient complaining of weight loss, numbness in the hands and feet, fatigue, and difficulty swallowing. The physical exam notes an enlarged tongue, enlarged liver, a rubbery feeling around the joints, and bruising around the eyes. A bone marrow biopsy shows an abnormal staining of denatured protein, see below. These denatured proteins are most likely to be which of the following? Question 9. A family of 4 from New Jersey has embarked on a vacation in the Rocky Mountains. All 4 required a 24 to 48 H acclimation to the high altitude, as all were breathing at a rapid pace until the acclimation took effect. In addition to increasing the number of red blood cells in circulation, what other compensatory mechanism occurred within the red blood cell during this acclimation period? Question 10. In the 1800s, British sailors on long sea journeys developed sore and bleeding gums, sometimes to the point that their teeth would loosen and fall out. The introduction of limes to their diets helped to prevent these occurrences. The biochemical step that was lacking in these sailors was which of the following? Question 11. A patient, who was recently diagnosed with cystic fibrosis, displays an increased blood clotting time. This is most likely due to which of the following? Question 12. You order a hemoglobin electrophoresis on a patient suspected of having sickle cell disease. A blood sample was obtained, and the red cells were isolated. Disruption of the red cells released the hemoglobin, which was run on a polyacrylamide gel. Following the electrophoresis, a Western blot was performed to locate the hemoglobin. The results of the Western blot are shown below. Which one of the following statements best represents the interpretation of the results? Question 13. Shown below is a section of a protein which forms a typical alpha helix. In the form of an alpha helix, a hydrogen bond would be formed between which two of the labeled atoms? Question 14. A 37-year-old female has trouble keeping her eyes open and swallowing, and is beginning to slur her speech. The patient has also noticed a weakness in her arms and legs. Treatment with hydrophonium chloride results in a temporary relief of symptoms. The underlying etiology of this disorder involves autoantibodies that do which of the following? Question 15. You see a patient on an initial visit and are struck by the bluish coloring of the skin and mucous membranes. You ask the patient about this, and you are told that it is a blood problem that the patient has had for his or her entire life. The patient's father had a similar condition, but not the mother. This condition could result from which one of the following changes within the erythrocyte? Question 16. Many drugs function by acting as inhibitors of particular enzyme reactions. If an enzyme's Vmax is 15 units per minute per mg protein, with a Km of 1.25 μm in the absence of inhibitor, but in the presence of 5 μm inhibitor the Vmax is 6 units per minute per mg protein, with the same Km, what is the velocity of the reaction in the presence of 5 μm inhibitor at a substrate concentration of 2.50 μm? Question 17. A 3-year-old boy is evaluated by the pediatrician as the child has trouble rising from a sitting position. Examination reveals calf hypertrophy and limb girdle weakness. The inborn error in this patient is due to which of the following? Question 18. An 8-month-old infant exhibits jaundice and lethargy. Physical exam detects splenomegaly. Blood work displays a microcytic anemia with abnormal erythrocytes, see picture below, under all conditions. This defect is most likely due to a hereditary mutation in which of the following? Question 19. A laboratory worker was working with a potent organophosphorus inhibitor of acetylcholinesterase in the lab when a drop of the inhibitor flew into his eye. This resulted in a pinpoint pupil in that eye that was non-reactive and unresponsive to atropine. He eventually, over a period of weeks, recovered from this incident. The reason for the long recovery period is which of the following? Question 20. A patient has midlife onset of the following symptoms: abnormal, involuntary jerking body movements, an unsteady gait, personality changes, and chewing and swallowing difficulty, which has led to a gradual weight loss. The patient's father had similar symptoms before his death at the age of 45. Cellular analysis indicated precipitated proteins in the nucleus. This disease has at its origins which biochemical problem?